Hi, and welcome to the OnCallMD webinar. I apologize for the delay. We had some technical issues. I appreciate you guys hanging in there for this. My name is David Hanowski. I'm the CEO of OnCallMD, and we're going to talk to you today about a little bit about our company, but also explain to you more about how to get paid for telehealth. And we have our Chief Medical Officer, Dan McDyer, here to take you through that. Just before he gets started, though, I just want to let you know that here at OnCall MD, we provide a telehealth offering that is free to the healthcare providers. We want you to be successful on our platform, and so a webinar like this is something that's very important to us. And I think with that, we'll get into the webinar. We're already a little bit late, and so Dan, I'll have you get started. And you can take over and get into how to get paid for telehealth.
Absolutely. Thanks so much, Dave. And yeah, once again, we apologize for the delay on the start of the webinar here. We had some kind of an issue technically speaking. It looked like nobody was showing up, and we thought we maybe had the wrong site. So anyway, we're here now. We'll get you really familiarized with a telehealth platform that's truly in my mind, the only solution-driven platform out there. And the importance of that is that we've got a medical advisory board, including myself, physicians that have been in practice for decades and understand the issues with adopting technology into the practice, adapting to it, and what obstacles are encountered, especially in this new era of telehealth and virtual care that has been thrust upon us with the coronavirus issue. I've been preaching telehealth for over 3 years, falling upon deaf ears the entire time until March of this year. So we were just starting to work on this platform at that point in time. So we went ahead and launched anyway with just a minimally viable product as we were working on all the different feature sets that we were putting into the system to overcome some of the most common obstacles that physicians and healthcare providers encounter in the telehealth arena. So one thing that is for sure is that no doctor or provider is going to adopt a new process if there's not a benefit for them. And what I'm talking about there is the major obstacle in telehealth is that in general it doesn't get paid by the insurance companies. And there's a lot of controversy right now as to how they're going to deal with telehealth from a payment perspective as the healthcare crisis concludes here in the not too distant future. Right now, the government is proclaiming that all telehealth should be paid at parity. That's not happening, unfortunately, but there are some insurance companies that are getting around to the point of understanding the importance of this. As a matter of fact, I'm a board member of the largest group of OBGYNs in the country, and our new contract with Aetna that was just negotiated is paying for telehealth at parity. That means they're paying the same for a telehealth visit as if it had taken place in the office. So that's phenomenal. But what I knew as we were developing this platform, we needed to put into the system a process that guaranteed the doctors and healthcare providers would get paid for their utilization of telehealth, because our time is very important. The only things we have to share in our business is our time and our knowledge base, which is our intellectual property. And when that's not respected, especially with something new like this, we're not going to adopt it. So we solved that problem with what we call the payment processing gateway. It's really extremely interesting how this worked. It took a lot of software development, and it's very functional and very, very customizable, which is the really neat part about this. So the way that this works, this is a screenshot of the doctor or provider's, we call it the back office or dashboard, and how they set up their fee schedule for their consultations, their telehealth consultations. And the way that this works is right up here at the top, you see authorized hold. The doctor or provider can program into the platform how much of a credit card hold or how much of a financial hold they want to put on the patient's credit card. Just like when you check into a hotel, you get, I think, usually about $200 is they'll put on hold on your credit card for any incidental fees. So we put a hold on the credit card. Why do we do that? Because when you and I do telehealth visits, we don't know what we're supposed to get paid by the insurance company or if it's even covered or not. So we have put a hold, we've partnered with a company that allows us to keep a hold on a patient's credit card for up to 30 days until the insurance contract or the insurance claim is adjudicated, or we get back to the office the next day or later that day in your office, the next business day, whatever. You can find out from your staff what the patient's financial responsibility is, and you can go back and charge that to the patient's card through our platform. So that's the importance of the credit card hold. You determine that based when you're programming your platform or your account. And now here Your consultation fees can be customized to be based upon the amount of time you spend on the call with the patient, or you can just charge a flat fee if you'd so choose. Here is an example of what I charge. I charge $50 for the first 5 minutes. Then for each subsequent minute, I charge $2. And that's during my regular office hours. We've got this so customizable, you can actually set up a separate fee schedule for after hours care. And you can program the platform to switch over from regular hours to after hours based upon what you consider your regular hours versus your after hours. For me, it's 8 to 5. I charge the regular hour fees. After hours, I add $10 to that first 5 minutes. So I charge $60 for the first 5 minutes instead of 50. And I add $1 per minute after hours because my time's more valuable after hours. So instead of $2 a minute, I get $3 a minute after the first 5-minute slot. And these here are representative of my times for the after hours care versus the regular hours. We also customize it for the weekends. If you so choose to charge a different fee over the weekends, I personally just consider that part of my after hours care, so I don't make any additional fees for the weekends at all. Some practices are open on the weekends, so they might consider charging regular hours, so we've got that there to customize your fee schedule. So that's how customizable it is. We can even program in holidays and kind of quote unquote special days. I didn't get into those screenshots for you, but those are like days like your anniversary or things like that. If you so choose your birthday to take call on that day, you can charge more if you so choose. And that's how we get paid for our telehealth business. I'll show you how that works in just a minute, but you customize your own fee schedule based upon what you think the value of your time is. And that's if the insurance doesn't cover the fee of the cost of the visit. So I'm going to take you through a quick little sample visit here. This is what the patient encounters when they've logged into their account and they're beginning to request a visit with you. They'll see that you're available. You can see that right here. The provider, the healthcare provider here, this is just a mock-up. This is David Taylor, and he's available for care. The patient will click Go to Waiting Room as the next step, and then what they'll see is this first screening, Request a Visit. They're asked what they're being seen for and what state they're present in to make sure that their state of residence matches up with the state of licensure for the provider. The second step is the patient sees what your fee schedule is. They see there's going to be a $100 hold placed on their credit card. Here's the fee for the first 5 minutes, which is $60. Obviously, I took this screenshot after hours. Each subsequent minute is $3 thereafter. The consultation fee, there's a tech fee for each one of these visits, $8.99 per visit. That's the cost that does not go to the doctor, that goes to the software company, us, OnCallMD. We get a fee on a pay per click or pay per use visit. That's how we monetize our business. That's how we can afford to keep customer service available, which is very important for our user base, both the provider, physician user base, and for the patient user base. And also it allows us to have enough funds to create future software development, which is very expensive. So we want to keep ourselves in the positive financial arena rather than being basically bankrupt like all the other telehealth companies in the marketplace are right now. They're stuck, they can't grow. So the third step for the patient is we accept their credit card. There's a little reminder on here that if the patient has an HSA or an FSA card, please use that because this is a medical cost that can be applied to those cards. And then it's just a consent to telehealth. And then they click Go to Waiting Room. And this is the screen they see on their smart device, their phone, their tablet, their laptop, their desktop. This is the virtual waiting room they're sitting in. And when this waiting room is entered, the physician or provider receives a text message to notify them that there is a patient in their waiting room. And there's also an email that's sent to the provider in addition to the text message. So this is a screenshot of the provider's what we call the waiting room. This happens instantaneously within milliseconds after a patient requests a virtual visit. They appear in your waiting room. And you can see this is what we call an on-demand visit, meaning the patient didn't schedule this visit. They've just requested it because they saw you were available. Doctor clicks on that, goes to the next step. You can see information about the patient here, why they're requesting a visit. This little icon right here, clicking on that allows us to send a text message one way to the patient. They can't reply to it, but we use that to let the patient know if you're running behind or something like that. This little file icon right here allows you to see some of the patient's medical history that they've entered into the visit. And then this just trashes the visit if there's some reason you're canceling it. It will ask you why. And then when you're ready to start the call, you just literally click that start call button. And then it basically is just any video call that you've made with some feature sets there. I'm sorry, for some reason, this screenshot does not have all the tabs along the side here where you can look up the patient's information, demographics about them. There is the ability to go back into their previous visits and see what's been done for the previous visits. There's e-prescribe capabilities here off of the platform. This icon right here allows for screen sharing, meaning if you have some files in your computer with images or things like that that you'd like to share with the patient, you can share that on the screen. And we also have a group call feature that's in beta testing right now where you can invite other participants into the video visit with the patient, whether it's one of the patient's family members or if it's another colleague who needs to do a second opinion or a more expert opinion in a specialty that may not be your specialty in the practice. So it's a fully baked video platform, audio platform with phenomenal power and capabilities. Once the visit concludes, this is what the patient sees on their screen. They're queried as to whether everything went smoothly. If they had minor technical issues, they asked what they were so we can make improvements to our system if those happen to pop up. And here's one really interesting one. I had a drop call. This happened to me yesterday when I was doing a telehealth visit yesterday evening. I accidentally terminated the call by trying to open up another tab to talk about this patient's risk of osteoporotic fractures based upon her DEXA T-scores. And I accidentally I closed my whole website. So I opened it right back up and she actually clicked, I had a drop call because she realized that it happened, and instantaneously she entered right back into my waiting room. And the important thing about that is that she did not have to go back through that payment processing gateway. It immediately linked her back into my virtual waiting room without having to encounter all those additional fees and things of that nature. And this is what appears on my screen when the visit concludes. If the patient requests a revisit, because the call dropped, this box right here will actually shake on the screen and highlight itself to let me know that the patient's requesting a reconsultation because the call dropped, which I'm sure you as a provider would be aware of also. If everything went smoothly, which it did once we got reconnected, I have the ability to either apply the charges to the visit right then and there, or I can process the payments later. And I do that if I don't know what the patient's financial responsibility is right at that point in time of the visit. So this is what the patient will see on their screen as I am preparing to charge or not yet process the payment for the visit. They'll see what the time frame was for the call, what the charges were, and they'll see this little hourglass will spin here saying verifying, verifying, verifying. Once I, excuse me, once I process the payment, the entire summary of what the visit cost will pop up on her screen. If I process the payments later, because I'm not certain of what the patient's financial responsibility is, this part will vanish from the patient's screen. They'll be asked to rate the visit and the provider, which is not public facing, it's all private facing, so we can keep statistics on our own internally. And when I do process the payment, like for the visit I did last night, I did not know what her financial responsibility was, so I just sent my staff an electronic message to the EMR. And this morning I found out that the whole thing applied to her deductible, and she had not met any of her deductible yet. So I clicked process the payment. She was charged the full fee for the visit, and she received an email and a text message to let her know that that visit had been processed and that the hold on her credit card had been released at that point in time. This is what I see on my screen as I'm getting ready to process the visit. I see the patient's getting charged the $8.99 for the tech fee that goes to OnCallMD. If indeed I find out, let's say last night the patient's financial responsibility was just a copay, if it was $30, well, the system calculated I should have been paid $60, but if I knew I only needed to get 30 from the patient, I would just enter right here in this box, discounts. I would have discounted that by $30 so that I would be getting paid just $30, and that money would be transferred to the patient's account here in the practice. So that's how that works. And once I correctly identify each component of the payment, I click proceed, and then we go to the next summary page. This is what the patient sees, and that's all done. That's what's emailed and texted to the patient. So once I've concluded the visit, I have the ability to write a progress note within the platform. We have our own little mini EMR records section, which the patients can actually read. They have read-only access to their visits, and I have the ability to edit my visit for up to 24 hours after the call took place. You know, subjective, objective assessment and plan the next steps. On occasion, like I said last night, I didn't process the patient's fee for the visit because I did not know what it was. So in your dashboard page, there's this category called payments. And we can go and click on that and it will tell us which payments are pending, what payments or visits you've already completed the payments from. This is a warning right here about payments that are about to expire. When you're within, if you haven't processed a particular visit's payment, and it gets to within 72 hours of when the credit card hold is going to be released, there's a warning that comes up here to alert you to the fact that you have some payments pending that you need to attend to immediately. Otherwise, you're going to lose the ability to charge the patient's credit card for that visit. Let's make sure I went to the right. Yeah, okay, great. So that's how we absolutely guarantee you're going to get paid for your telehealth visits, whether it's fully by the patient, partially by the patient, partially by the insurance company, or completely by the insurance company. Everybody's getting paid correctly. It's a fully functional payment processing gateway. It is the most amazing addition to telehealth to encourage doctors now to use telehealth. Because before, you know, we all hate change. It's a 4-letter word. Who wants to, you know, we're so protocol driven. We're so busy in our practices. We don't have time for something new, especially if we're not going to get paid for it. So this is the carrot at the end of the stick. You're going to get paid for your telehealth, and it's very handsome payment too because it's so efficient. There's no need for extra overhead around. The staff doesn't need to be there. You know how all this stuff is profitable. So we are, like I said before, a completely solution-driven platform. We identify problems, we create solutions to them. A very, very exciting addition that is being completed today is called the OnCall Cloud. As of now, there's really no way to provide after-hours care to your patients via telehealth unless you take call 24/7, 365 yourself. But we are allowing we've created a software feature that allows our providers, our participating providers, to assemble call groups. The exciting thing about this for me is I can get rid of my answering service. I already did. I was paying $200 to $300 a month for my answering service, so they could do what? So they could forward me patient phone calls at night and on weekends that I would deliver care for free, and then I'd assume that liability of that call because I usually didn't have time to document those calls. So we've gotten rid of our answering service, and now, as of about next week, I'm going to be able to start asking my colleagues to join me in the platform OnCallMD, and we're going to start setting up call groups. It's a feature that allows us to leave our offices open 24/7, 365, so our patients in those 70% of the week when we're not open, you know, we're only open like 30% of the week, our patients can now not have to go to the ER, urgent care, minute clinic, use Teledoc or Doctor on Demand or MD Live. They can see you or a colleague that you have designated to take call for you during those after hours sessions. The really cool thing about that is that's what 60% of people want. If they're going to use telehealth, they want to have access to their doctor or to a doctor that their physician has designated as being sufficient to deliver care to them. They don't want to use some random doctor like on Teledoc or those other version 1.0s of telehealth, as I call them, which they provide a great service, but we can supersede that very quickly. This enhances patient care, and most importantly, it allows you to keep the patients in your care loop and keep that revenue within your platform, within your practice's platform, not getting it paid to other entities like the ERs and the Doctor on Demands and places like that. So very exciting feature. So what will happen is if at night or on a weekend I'm not available, my patient will seek a visit with me and they'll see this little icon here that says preferred provider is not available. But they can click on see next available doctor. When they do that, it lets them know that Dr. Daniel Aaron is currently available for on-demand appointments. If they so choose, they can proceed to that site. We're going to reword this a little bit to let them know that they're actually my colleague. They'll click go to waiting room, and our platform, go back for a second. Our platform we have a, what's the word I'm looking for? Drawing a blank here, an algorithm that the platform uses to seek the next available doctor that you have agreed to keep in your call group per se. So it's prioritized. So you basically set up your own call system. There's a calendar feature where you can make sure every night and every after hours session is covered. It's all right there online instead of keeping a calendar in your phone or a calendar on paper as to who's covering call when. It's all virtual right there on your computer. You can look it up on your phone, all those things. You can invite people into your call group. It's a phenomenal feature. I don't have the screenshots to share with you, and it'd probably prolong this call too much, but we'll get into that later on once you guys start using OnCallMD. Super exciting, and we love that feature. Future developments that are coming down the road, I call it pseudo integration into the EMRs. To truly integrate with an EMR is very expensive. It's 20 to 30 grand just to open up the book to say, I'd like to do this. Then typically they want 20 to 30% of our revenue to allow that to happen. That's a waste of money. We've got artificial intelligent bots that are capable of going into the EMR platforms and extracting in a bidirectional fashion the information that needs to be shared between our platform and the EMR platform. It's very exciting. That's coming down the road probably in the next 4 to 6 months. We beta tested that on some of the EMR systems. It's already working very effectively. We've built a native app for the iPhone and mobile iOS platforms. If you've ever used telehealth before, most likely you've run into the obstacle of connecting with people who use the iPhone or iOS mobile platform on their iPads. They have to use Safari because Google will on the mobile Apple devices will not work with the audiovisual platform called Twilio. It's too much information for you, but that just will not work. It will not make the connection. So patients still have trouble getting on Safari and using that as their browser to enter their OnCallMD account. So we built an app to bypass that. That's been beta tested. It's going to be live and available, I think, this weekend. And we're building an app for Android in the not too distant future also. Like I said a few moments ago, we've got file sharing and screen sharing. We will be integrating biometric monitoring devices probably within the next 6 months. I think it's on a roadmap for 6 months from now. There will be a virtual assistant and voice to text in the platform so that rather than typing your notes, you can actually voice to text your notes. The virtual assistant, you can actually talk to your computer and tell it where you want to go within your account to find different pieces of information, like please pull up the note on Jane Smith that I wrote on December 12th or something like that. I'll go in there and find that for you. And we'll be working on discounted tech fee packages because, for instance, in my specialty, obstetrics, probably about 5 of the 14 or so prenatal visits can be accomplished virtually. And I've yet to run into an obstacle with the patients complaining about the $8.99 tech fee. As a matter of fact, when we're trying to determine what the proper fee for that would be, I actually surveyed about, I think it was like 225 of my patients in the office and told them about what telehealth was, that there'd be a fee for it, paid by their insurance or by them, and that there'd be a tech fee associated with the visits too that goes to the software company. And I asked them, number one, would they use telehealth, yes or no? 56% said they'd use it. And if so, what would you be willing to pay for a tech fee? And the average that they stated was $18.73. I left that question blank for the answer. And that's what the average was. So $8.99 is not a big deal to them because they're used to paying shipping and handling charges on Amazon and stuff like that. Another really important obstacle that we've overcome is the awareness of telehealth being available within the practice. We help you market this service to your patients because, why? Because it's so profitable when you use it, because there's really no overhead associated with it. So we have email marketing campaigns to assist with notification to the patients of your utilization of telehealth. We can add this to your websites, which is what I've done. And we have digital interactive brochures that you can leave in your exam rooms to explain to the patients the value of telehealth and why you're using it. Actually personalized messages from you if you so choose. So with that, I'm going to turn it back over to Dave, our CEO, and all of his expertise in the software industry. I'm obviously very, very excited about what we've developed with this software platform. It's going to be, as of this weekend, the most powerful, if it's not already the most powerful in the marketplace, with interactivity, insightful use, intuitive use, very simple, very customizable to adopt it into the practices in the most efficient, integrative form that's possible. So with that, Dave, just talk a little bit about what's going on in the telehealth world. Thanks so much, guys.
Absolutely, Dan. Thanks for that. I really appreciate your passion, and Dan is the thought leader behind a lot of the functionality you see here within OnCall. And just on that previous note about marketing, because our product is free to the healthcare providers, our goals are very much aligned. We want our users to be successful with telehealth. And so when our users are making money off of telehealth, we are. And so we're very motivated to want to make sure that you're successful using our product. I just want to talk a little bit because I get asked after these webinars, and so I've just added it into the deck about our company and how we're structured in terms of investment and whatnot. And I just wanted to share a couple of points with you on the telehealth market. If you look at this slide here, this is some very recent data, and pre-COVID, these numbers were actually smaller than this. And if you look 2026, the whole market, worldwide market for telehealth being $266.8 billion, we feel just by getting us, we can get a small percentage of that and be extremely successful. And so this gives you an idea of the scale and what we're about and what we're after. Dan, please go to the next one.
Oh, it's stuck. Hang on a second. There we go.
There we have over 300 practices enrolled since we released, and that's significant because the HIPAA waivers are still in place, or they may have been removed recently, but they're, as of the last time we checked, the HIPAA waivers are still in place. We've made partnerships, strategic partnerships with organizations like the Physician's Assistant PAVMT Association, and we've made several medical advisory board relationships, and we believe that this pandemic has lasted long enough that now that as a software person, you look for disruption in markets, and nothing has disrupted the planet more than in my lifetime than this pandemic. Probably Y2K was the one before this, but we believe that going forward, that telehealth is going to be part of most practices, and that almost every practice is going to have a telehealth component to it going forward. Go ahead, Dan.
Sorry, my processor must be a little overwhelmed. There we go.
Okay, this is our management team, and we'll be quick here through these last couple because I know we're over a little bit. Go ahead, Dan. We've had previous exits. We've all worked together before. We've all brought products to market before, and we've all successfully got them to exits. And so anyone that's considering investment, we have a track record of bringing, turning those investments into bigger dollars. Go ahead, Dan. And just to give you an idea of the space that we're in right now, some recent telehealth exits. Teladoc itself is public. They trade for 26 times revenue. Healthiest You sold for 12 times revenue. Best Doctors 10 times. InTouch Health 8 times. So it's a very strategic market right now. And so you can see where just getting our revenues up to a very healthy range could yield a very significant return. And we do have some investors right now that are doctors, and they've invested right out of their IRA. So that's something that's very possible and doable, and we can help you with that. And we do have an exit strategy. The list of potential acquirers is vast. It's significant, and almost anyone that's in healthcare right now of any significance is thinking about how they can get into telehealth. So we believe our timing and our positioning is perfect right now. And we are looking to raise up to about $3 million. We've raised some of that already. Most of it going on sales and marketing. We've got the product in market. And the way I like to look at it is we're looking for gasoline to pour on the fire, and we think that we can go a lot faster with more capital raised. And I think the last slide here would be, we behave, even though we're private, we want to behave like a public company. Full transparency, full disclosure. I'm just preparing the last quarter's reporting package right now to all our existing investors, and you can call me or email me anytime. Thank you for attending, and hopefully we've been able to enlighten you in terms of how you can get paid for telehealth. I know that's been a problem. As Dan likes to say, telehealth version 1.0, getting paid was a problem, and we feel we've resolved that. And if you have any questions or concerns, please feel free to reach out to me. David Hanowski, the CEO, and our Chief Medical Officer, Dr. Dan McDyer, did the presentation. So thank you very much for attending, and we'll reach out to you for your for your Uber Eats cards. Thank you for joining us.
Thanks so much for your patience, guys. We apologize for the late start. Have a great day.